let's talk about three possible reasons you might be experiencing back pain. And then let's go into a little bit detail and see if we can't solve it a little bit. Okay, so these are kind of the three that I see the most often. Of course, there's some other possibilities. Um, Seeing a doctor, making sure that nothing is serious is going wrong is always helpful. But especially for postpartum pregnant or postpartum women, or people who sit a lot at a desk. The back pain can be caused by a couple different things. So the first is going to be an anterior pelvic tilt. The second is going to be some glute gripping. And the third is going to be posture related to the baby. And that can kind of go one of two ways. So we'll talk about that too. So maybe it's three and a half or four reasons, but you'll kind of see why just really three reasons and how the baby affects the posture. So if we look at an anterior pelvic tilt, right? So if you think about it, I'm going to exaggerate it quite a bit, but your pelvis is spilling forward. You have a nice deep arch in that lower back. Belly is protruded. So that means that the back of my hamstrings are super lengthened, as well as my core, where if we come back into this more neutral position, okay, my hamstrings aren't quite as lengthened and my core is not quite as lengthened. So if you think about doing a bicep curl, right? When you start with a really heavy weight and your arm is in this fully extended position, it's much harder to start the movement than if we grab the weight and go from here, correct? So we think about that full range of motion, okay? Just like hamstrings, we're at that lengthened state all the time. Core at that lengthened state all the time. So the back kicks in to try and get some extra stability that's missing. The other thing that can happen in that anterior pelvic tilt that can cause some of that back pain is that the hamstrings and the core are what help bring you into more of a neutral pelvis. The hamstrings work on the back of the pelvis and the abs work on the front of the pelvis. If neither of those are strong or you're tipping forward and they're super lengthened, the back is going to try to create that stability instead of just hanging out on those joints, which can then also be part of where glute gripping comes in, very similar. So maybe you're not in an anterior pelvic tilt, but you're squeezing your glutes and you're really super rounded here. Okay, and the glutes are always on. They're super tight. You're just squeezing the heck out of them. When you do exercises, you really give them that extra squeeze. Squats, whatever, you're really forcing that glute gripping. Very similar, the body is looking for stability that it's not getting other places. And then the third and final reason that tends to be the most prominent for women who are going through pregnancy or postpartum is going to be posture with the baby. So pregnant, obviously, still the baby is still going to affect your posture. This might be when you start to do the glute gripping or tilting into that anterior pelvic tilt as the baby grows. The baby is stretching the core, so maybe you don't glute grip or tip into that anterior pelvic tilt, but now your abs are stretching out and they can't do as much work, so the back takes up some of the slack, right? Then once baby is here and you're in that postpartum phase, are we, sticking out our hips, sitting baby on it, just doing it on one side all the time? What does it look like when you go to pick up baby? Are you able to get into a good hinge? Are you rounding a lot? All of those things are going to matter. If you're holding baby in front, are you doing this? Okay. What's happening every time you lift, bend down, pick up, hold baby, especially as they grow? And of course, we all know super early postpartum, they are growing fast. They go from 8 pounds to 20 pounds like this. So if you're not practicing with heavier weight, if you're not working on good form, that weight of your child is getting heavy very fast and is going to cause some postural problems. It also matters the positions of how you sit while you feed baby, bottle or breast. Okay. If you are doing a lot of sitting, especially early in the postpartum recovery phase, what does that look like? What is the posture while you're sitting? Are you getting in and out of the chair without using your lower back? Are you using things like your hamstrings and your core? Are we getting those to fire again to help us, right? So this is where the posture with baby comes in. It's not just while you're growing baby in pregnancy, but also feeding, changing, holding, lifting, bending, cleaning up after baby postpartum. How is your changing table posture? What is the height of your crib? All those things are going to affect some back pain and posture. And so making sure that you can strengthen yourself to support you in a way that gets you in and out of these postures. Now, there's plenty of people, myself included, who are probably forever going to sit in an anterior pelvic tilt. The difference now, because I also had serious back pain when I had my second daughter, I can take myself in and out of that full range of motion. I don't sit nearly as dramatic of an anterior pelvic tilt as I did after her pregnancy or her birth. And I am also stronger in my core and my hamstrings now. So I'm getting that added support, even if I may never fully come out of a ATP completely. Okay. So all of these things are going to matter. Strength is going to matter. Making sure that strength is balanced in the system, that's a big key component. And so if you're having back pain and one of these things or any part of these things resonated with you, we can help solve it. We just need to kind of look at what's causing it, what your posture looks like, and where the imbalances in your body are, and start strengthening from there. So that's what my assessments look at. That's what we work on in one-on-one training. And of course, if you have any questions where I can kind of help point you in the right direction and this resonated, make sure you like and share, and feel free to ask any questions you have. And I will see you guys next time.